topics and opinions expressed on the following show are solely those of the host and their guests, and not those of W4CS Radio, its employees, or affiliates. W4CS makes no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. Any questions or comments should be directed to those show hosts. Thank you for listening to the Cancer Support Network on W4CS.com.
Hello, everyone, and welcome back to Survive and Live Well, tips to treat and beat cancer. As always, my goal is to empower you with information to help you regain control of your health. My guest today, Karen Dahm, is a nationally known and respected figure in holistic healing and preventive health care. A certified holistic health practitioner, wellness and nutrition consultant, Karen is an influential voice leading conversation on personal health through her website, Karen Dahm Healing Solutions, and through over 7,000 followers on her Healing Solutions Facebook groups. Karen's depth of knowledge and ability to cut through the noise and misinformation to reveal the truth of healing make her an especially treasured and valued resource for well-being. Karen joins us today from her home in Scottsdale, Arizona. So wonderful to have you here, Karen.
Thank you, Ellen. I'm happy to be here with you today.
Well, I'm looking forward to our conversation.
As am I.
Great. So perimenopause is for many people a 10-year journey. Some have an easy journey, and well, some do not. Karen, your journey was, shall we say, not one of the easier ones, and it likely inspired you to become highly educated on the subject, as I would imagine. So perhaps you can tell us a bit about that journey.
Well, that's right, Ellen. My experience with perimenopause was indeed the catalyst that led to the work I'm doing now. It was, in fact, a storm I weathered for 10 years that at times I believed would never, ever end. And at 38, I began to see changes and feel changes. My complexion was not as clear as it had always been, and I had felt irritable and had less patience with myself, my family, my friends. I had no idea that this was, in fact, the prelude to what was just around the corner. And on the day of my 40th birthday, everything, my world as I had known it, came crashing down. The symptoms of perimenopause hit me so hard, and I had never felt as sick in my entire life. Throughout the subsequent months and years that followed, I realized more and more symptoms, and I was experiencing things like low energy, weight gain. I had erratic mood swings, the anger, the depression. I had incredible abdominal pain, and the worst symptom of all that I later found out was anxiety. These symptoms very often were debilitating, and at times the anxiety was incredibly intense that I felt like a prisoner in my own house. Just a simple task of getting in my car and going to the corner to retrieve my children from the bus stop was something that was terrifying to me, and I often had to rely on the goodness of neighbors to bring my children home when I couldn't. My symptoms hit me with an intensity that was unrelenting, and in retrospect, I probably had most of the symptoms that accompanied perimenopause, and every month the mix of symptoms would change, and they would arrive at different times, and that is the roller coaster that is perimenopause. It made it next to impossible to plan my life and events and parties, and again, a simple task of taking my children to birthday parties of their friends was just horrible.
Sounds like a very difficult time for you, certainly, and also your family. I often wonder what my family thinks when I, act quite erratical over some very minor thing when I'm normally very calm, and they kind of look at me like, so what? That wasn't earth shaking.
Exactly. And I found myself wondering the same thing. Why am I reacting? Why did I react so poorly? I never, at another time I wouldn't have reacted quite that way. But I knew as I continued into this journey and did my research and read every book I could get my hands on, I knew that it was, in fact, symptoms of perimenopause. And the key was, identifying it, finding help and knowing and reminding my family and friends that it's not really me, it's just the phase.
That's right. And again, to kind of recap on some of those most common symptoms, skin changes, anxiety, weight gain, fibroids, mood swings, anger, forgetfulness, forgetting to be that you're forgetful,
Right.
lack of concentration and
Right.
focus, right? Low libido,
Right.
insomnia, hot flashes, irregular periods,
I
and it
mean,
really goes on and on. And part
it
of what
is.
yeah, part of what we're going to talk about today is not just are these horribly annoying symptoms, is what they could actually really mean about maybe some imbalances that you have going on in your body and things there in some ways red flags to go up and say, hey, I need a little help here, and what we can perhaps do to correct those, or that we need to do something to correct. Not that we can change perimenopause, but that maybe there are things that we can do to make it a little smoother. So that,
Absolutely.
right, we
Absolutely.
lose
And
those
step one is
RTs.
identifying that is the phase that you're in.
That's right.
And the key is, and always is, balancing those hormones, understanding it's a hormonal imbalance, finding out what that imbalance is exactly. And for every woman, it's going to be different. Finding a literate doctor who is well versed in women's hormones and health, and creating that balance once you understand where it is.
Right. And for that, I would really suggest in many moments, actually, I'll ask you to suggest who someone might go to, because not every OBGYN is really going to understand this kind of testing. So who would you recommend people go to, or what would you recommend that they do?
Well, that's exactly true, and it's a great question, because it's probably one of the most difficult tasks is to find someone, to identify a doctor or a practitioner who is well versed in women's hormones, outside of the conventional synthetic hormone or synthetic HRT approach. I've got a lot of women who come to me and ask me that very question. I don't like my doctor. I don't like what they've prescribed. I don't like this protocol that I'm on. I don't feel any better. How can I find somebody that I can trust and that understands? The first thing that I always recommend is to Google it, look in your directory, and find a compound pharmacy that is in your neighborhood or near your neighborhood. Call the pharmacist, explain your situation, and they will often provide a list of doctors for whom they fill prescriptions for bioidentical hormones.
Right. But before we get to that, how does somebody go to get their levels checked? Who would you send them
You
to?
would need to go to a gynecologist. That is the doctor to go to explain to them that you feel like you're having these symptoms and they may be consistent with perimenopause, and they will run all of the proper testing to determine your hormone levels. It can be done through a blood draw. It could be done through a salivary test, through various labs in the country. And some doctors even carry those test kits in their practice, and they'll hand it to you, and you can take it home and do the test in the comfort of your own home and send it to the lab yourself.
Great. Okay. So, and if that doesn't work, if your doctor looks at you like you're crazy, maybe we're acting crazy, but we're not, then go to maybe a naturopathic doctor.
Absolutely, a naturopath. Absolutely, right. A naturopathic doctor or an osteopathic doctor. There are female practitioners that are well versed in women's health and hormones. Generally, though, it comes down to, and I hear this a lot, women often need to find someone who is in their medical insurance network. And right. That's where it becomes, rather difficult, because it almost seems like all of the cutting edge doctors who really understand bioidentical hormones, for instance, are those that are out of network. So then you're faced with making that choice. Well, do I save the money and see this out of network doctor because they know more, or do I just continue my search and go through my insurance company and hope that I will eventually identify someone who gets it?
Right, right. Because that's the important thing. Because sometimes you go to your OBGYN and he says, no, your levels are perfectly normal.
Oh, yes.
And you don't know if, they've really done the right testing, if they've done complete testing, or if they're just pacifying you. So exactly. Those are great recommendations. So Karen, perimenopause happens as a result of aging and declining hormone levels. And these changes in hormone levels, can lead sometimes, often to cancer. So perhaps we could talk about this.
Absolutely. Perimenopause is, or it can be, a very precarious time as hormone shifts and happen and create new and changing symptoms. Progesterone, for instance, is a key hormone, and it's actually a major player in perimenopause because it is the hormone specifically that begins to deplete. Progesterone is made in the ovaries, and as the production of progesterone begins to decline, we are left with excess estrogen, more commonly referred to as estrogen dominant. That is the term most people use. Excess estrogen can be very dangerous because it will look for a place to store itself. And when it does, that generally occurs in the uterus or the breast tissue. The uterine lining can become abnormally thickened, and breast changes can develop. Fibrocystic breasts are a notable symptom, and it is a particular concern. Some doctors will tell you fibrocystic breast disease is nothing to worry about and will never turn to cancer. That is definitely not the case. I've had women tell me this. I've experienced myself. Don't worry about it. It's a benign condition. That isn't the case. It is a condition that, as you mentioned earlier, results from estrogen dominance, and it can also be a result of iodine deficiency. Since the liver is the primary site for estrogen clearance, a compromised liver can lead to estrogen dominance too. If you're experiencing heavy bleeding and even clotting, get a uterine ultrasound to determine the thickness of the lining and work with a doctor to determine whether you'll need an ablation or bioidentical hormone therapy. I urge you really to stay on top of changes in your breast tissue through thermography and definitely self-exams, because elevated levels of estrogen are a big concern. And as we know, Ellen, because it can lead to cancer, it's a huge red flag. In my own experience, I was 2 years into perimenopause when I had an ablation. The results of my uterine ultrasound indicated my uterine wall was abnormally thickened, and I had intense pain and very heavy cycles. Both of those symptoms are symptoms of an estrogen level that's just too high. Had it not been for my doctor, whose guidance I did follow, left undiagnosed and untreated, this would have continued to thicken and likely could have become cancerous. So it's really, really important to stay on top of the changes that you are realizing in your own body and finding a doctor who really understands the changes of this phase of life.
Right. And that's really the key point here, is not every doctor understands that. And if you feel that you are not being heard, or that something is wrong and they're telling you not to worry, everything's going to be fine, it's perfectly normal. When you hear that and you don't feel perfectly normal, it's time to move on and get a consult with another doctor.
I was just going to say that. And sometimes it takes, sometimes it's a task and a journey, and it takes, moving from one doctor to the next. And what I try to tell women who I counsel, make phone calls. You can interview a doctor over the phone. You can call a practice and say, does this doctor, or how long has this doctor been working in the field of bioidentical hormones? Do they understand thyroid function and how that plays into symptoms of perimenopause? And above all, do they prescribe bioidentical hormones, or are they someone who just prescribes synthetic HRT? So these are all questions. And I've done this myself, gone through a list of doctors and made my phone calls, a few every day, and asked the important questions until I found somebody that I felt like I resonated with. And then from there, you make your appointment. And hopefully you've hit the jackpot and found the right person.
Right. And sometimes you might not actually get to interview, so to speak, the doctor on the phone, but you can get a nurse or the physician's assistant or somebody that can give you very valuable information. Not every doctor is going to pick up the phone, so don't get discouraged immediately. I mean, they may be giving their time uninterrupted to another patient, but you certainly could ask if there's somebody else you can talk to get a feel for the office, to get a feel for what you're going to hear when you go to that place, as opposed to the cookie cutter.
And you can always, if it's somebody in your area, you can always walk in And sometimes that's a great thing too, because at least you see the office and you get a feel, a sense of what their approach is and how they, interact with their patients. So there's lots that you can do. And there is for instance, there is a women's international pharmacy that is nationwide. You can call them.
Yep.
They will provide you with a list of doctors in your area who will who are very well versed in bioidentical hormones.
I can just see Karen now. She's going to be she sleeks into doctor's offices wearing her big floppy hat and her sunglasses and sits down. Can I help you, ma'am? Oh no, I'm just looking.
Yeah,
I'm waiting
the joint.
for somebody. I'm waiting for somebody. And she sits there for hours trying to find out if they interact well with the patients. Are they nice? What kind of conversations? Because you do learn a lot sitting there. So I can just
really
picture that
do.
now. There's Karen sitting there in the corner. No, that's okay. I'm okay over here. Thanks.
Well, not exactly. I generally walk in and have a conversation with the receptionist or the office manager. And as I'm having that interaction or that exchange, patients are walking in and out. You can really get a very, good sense of whether this practice, seems to resonate or not. But of course, calling is just as well. The key is to ask the questions, ask the necessary questions. And if you get all the right answers, you've found the right practice, hopefully.
And if you're really getting the runaround or you really have to talk to the doctor about that, then you have to decide, read between the lines. Is that because the nurse really doesn't know, which is fine, or the person, or that, you're not going to get any information, which means you're probably not going to have a very productive visit.
Right. Or they will not permit you to talk to a doctor or not give you the information you need. And instead, they will court you to make an appointment and come in and have that interview. And, everybody's different. Maybe that is the best way for someone to evaluate. But the key is, again, to just ask the right questions and hope that the response is what you're looking for.
Right. Because really doctor availability is a key player in your decision, because as many doctors that I take my family to, or I go to, where you have access to the doctor, you have either their cell phone number or you can send them an email. And those people I respect very highly. They're very busy people. We're all very busy people. But the fact that they will spend their valuable time answering a quick question. And I don't mean you can send them a long email,
No.
45-minute discussion, but hey, I'm having this problem or whatever. And you can actually get in touch with them, as opposed to saying, oh no, you'll have to make an appointment for that.
And
it's Saturday night and I have a problem now.
Exactly.
A week from next Thursday, I might not have that problem.
And these are the doctors. These are the doctors and practitioners that I personally feel are clearly, in it for the right reasons and sincerely interested in helping people to regain their health or to optimize their health. I love when I find a practitioner or a doctor who is that open and that welcoming to invite you into their free time to answer questions or discuss a problem. I love that. I really do. That's terrific.
Right. And I never want to, be annoying to a doctor or anything, but I just had this incredible personal experience, nothing to do with perimenopause, since I'm talking about my father, but I'm just going to throw that out there, that he had his team of doctors who were really very elusive. You call up, if you're lucky, you could hit one of dial 1 for this, dial 2 for that, dial 3 for that, but never do you actually speak for anybody. You're just doing a lot of dialing. And, I took him to a doctor in the city, a completely different team. And not only did they take your phone calls immediately, answer your emails, but they actually email you the next day to say, so how's your dad feeling? Maybe maybe I should talk to his doctor. Maybe we should try something this, just in complete follow-up and a really genuine interest in his patient. Actually, even before he was a patient. So sometimes it matters that you find the right doctor that was willing to treat you as a person.
I think that's an important point, Ellen. That's a critically important point, because it's so difficult to identify those practices like the one you just mentioned, which we should share with everybody who that is, because that's tremendous. And if I were still living in New York, I'd probably sign up with that practice. That's fantastic.
They were just phenomenal. On a Saturday afternoon, my dad's at another doctor's office and he didn't like the way things were going, and he emailed and they immediately took care of it. It was amazing. And it was a whole different group. It wasn't just his practice, but a whole different connection. Each one led me to another one who was equally absolutely amazing.
That's
So
wonderful.
sometimes, right, you just have to find the right people who, again, you don't ever want to abuse that privilege, but when you want to know that it's there when you need it.
Absolutely. And as I said earlier, sometimes it's a process. And
That's right.
I've
It
spoken
is.
to women who have gone through, upwards of 5 doctors until they found somebody who they resonate with and who is really, treating them as an individual rather than really a patient, and
That's right.
interested in how they're feeling and have your symptoms improved. And if not, let's look at what you're doing and tweak this and tweak that. It's important. So
It
I would
is. Okay,
encourage
so
people to just be patient.
right, to be patient and be persistent. So let's go back
Absolutely.
to our topic here. So what can we do to balance our hormones? I know many times it's not that we have too much estrogen, it's that we don't have enough progesterone or something is out of whack. So what can we do here?
Right, right. And that's a great question, Ellen. First, I'd like to say that, for women who are not completely well versed in the phase of perimenopause, it is, in general, a phase of life that happens around the age of 35. And for some, it can happen earlier. I've actually talked to women who began the process at the age of 30 and they were done by 40. That, I would say, is less common, certainly. But to answer the question, there are so many things women can do to help their bodies get back into balance. And that is key. When you have more balance, you feel better and your symptoms improve. So, this is what I tell people. Bioidentical hormones are an important consideration, and they should be really talked about with your physician if you are symptomatic. They add needed hormones to the body for a better balance. Ephemal primrose oil is another great supplement. It is a good omega-6 that balances hormones and particularly useful for symptoms of PMS. Omega-6s, I know, they get a bad rap because they're known to be an inflammatory oil, but ephemal primrose oil is the purest, and it is the exception because it is an anti-inflammatory oil. Another supplement is called DIM, and it's spelled DIM. It contains a compound from cruciferous vegetables that escorts estrogen, excess estrogen, out of the body. Now, iodine therapy is one of my personal favorites, and I love it because it does so many good things. Iodine downregulates estrogen while upregulating progesterone. That's really important for balancing hormones. It helps to eliminate fibroids in the breasts and the ovaries. And it is also needed for proper thyroid function and as a natural cancer preventative because it induces cell apoptosis, which is cell death. It's needed for the thyroid gland to secrete thyroxine, which is a thyroid hormone. And iodine deficiency can also cause fibrocystic breasts. Who knew, right?
Mm-hmm.
There's also research that indicates that zinc supplementation will increase the production of progesterone, and zinc is great because it's also important for thyroid function as well as gut function. Now, when I talk to people, when women come to me and ask me, I'm not feeling well, my hormones are out of whack, the very first thing we look at is diet. That's really important because food choices can make your health or break your health. Eating 3 meals a day, making sure that you have protein at each meal is critically important. A lot of women skip meals. This is a huge no-no because skipping meals will slow the metabolism. What happens when the metabolism slows down? We gain weight, right? Eating plenty of fruits and vegetables. They're high in antioxidants. Antioxidants combat cell damage from free radicals, which cause illness and disease, right? I'm a huge advocate for eliminating all grains. Grains are known to be an inflammatory food. Getting your fiber through a rainbow of fruits and vegetables. Fiber binds itself to estrogen and clears it from the body. Now, maca root is also a great item. It boosts the production of hormones as well as libido. It helps to minimize PMS symptoms. It's also very high in minerals and essential fatty acids, and these are great for hormones. The liver, a very, very important organ for hormonal health, because the liver inactivates excess estrogen, which is then cleared by the kidneys and leaves the body through urine. If your liver is compromised or impaired in any way, it can cause a buildup of estrogen. And we just talked about, or I just mentioned the supplement DIM, DIM. Indole 3 carbinol is the compound found in cruciferous vegetables. It's an estrogen metabolizer. It's found in cruciferous vegetables, broccoli, cauliflower, Brussels sprouts, spinach, flax seeds, things like that. It metabolizes the estrogen and gets it out of the body.
Right.
Something
One thing I want to
else.
stop you 1 second.
Yeah.
Keep going is that many people who have thyroid issues are not able to eat a lot of crucifers, especially raw. So DIM being an excellent supplement might be of interest to folks there.
Yes, that's an important point. Cruciferous vegetables, as you mentioned, do cause thyroid damage. Therefore, it will, if you eat them raw, it will change your thyroid function and generally cause hypothyroidism. Having said that, there's enormous health benefits in cruciferous vegetables. So we need to incorporate them in our diet. The key is for those individuals that have thyroid issues, eat your cruciferous fruits and vegetables, but they have to be steamed or lightly cooked. And that's the key. Now, in the supplement DIM, it's not a problem. There are no goitrogens. They've been, processed or heated so that isn't an issue. So you can feel comfortable. The key with DIM, though, read your ingredient level because many sources of DIM have or contain soy. There is one particular supplement that I've been able to resource, and I actually have it on my website, that is soy-free. So that's something that should be considered because it will escort excess estrogen out of the body. Calcium D-glucarate is a nutrient found in foods like apples and oranges, grapefruits, and broccoli. It helps to lower high levels of estrogen. I always tell people to incorporate omega-3s to balance hormones. They can be found in flax and chia seeds, walnuts, fish oil. Limit caffeine. And I say this especially if you have a heart condition or anxiety, because that caffeine will rev the body up and possibly, exacerbate those symptoms. Eat healthy fats like olive oil, coconut oil, pastured butter, and avocados, all great fats. And, if you're feeling like you have a compromised liver in any way, and maybe that's, inhibiting your body from releasing excess estrogen, great herbs like milk thistle, raspberry leaf, and chasteberry all help with hormonal balance. Milk thistle is an excellent liver cleanser, and chasteberry and raspberry leaf help to increase the production of progesterone. So as you can see, hormone imbalance is not the end of the world. If you understand what's happening in your body and you know that there are things you can do and explore and take that will help to balance yourself out, it can be a smooth process through the journey. It doesn't have to be the nightmare that it was for me.
Right, which is important. There's things that we can do. We always have options, and we always need to look at them. And I think before people just run off and say, I'm going to do bioidentical hormones, these remedies that Karen has presented here, natural remedies, are the best. I would think the first place you want to start and see if some of these things make you feel better. See if it starts, if it works, then you might not have to go down the route, because not everyone can do bioidentical hormones. And not everyone can do everything on this list, but you work within the list of what you can do, these guidelines, and you see if it makes a difference. And if something does, you add more of it. Not, don't go crazy, but little by little, you make changes until you see how you feel. And if that doesn't work, of course, then, maybe take a look at the bioidentical hormones, especially if you don't have any gene mutations or something that prevent you from doing so.
And it's trial and error, because what works for one person, may not work for someone else. And that's why there are so many, things that you can explore and can try. And, but I always recommend beginning with diet. Look at the diet, get rid of the processed food, get rid of the sugar, get rid of the, the white flour, because most people have no idea how these toxins affect the body. Right. And can throw the body out of whack. And that doesn't mean that you're, by eliminating these things, you're going to skip perimenopause. It's a natural progression. It's a part of life. It's a phase that we all, come up against and go through.
The way you go through it is all the difference. I mean, I know I used to have terrible PMS my very young years. And as soon as I turned my whole diet around, gone. I mean, just gone, gone. The moodiness gone, the cramps gone, everything.
See?
And I don't really have it other than a little forgetfulness. I don't know if that's old age or perimenopause, and maybe a little odd, reactions once in a while. But that just could be me, with a lot on my mind. But I have to say, it's like night and day compared to where I was and where I am. And so I highly recommend, again, if you can't do one thing, some people can't, they're allergic to this, or they're, have an aversion to that, or whatever their situation is.
Right.
There's so many ways that you can alter your feelings, and your reaction to all of this.
Exactly.
That is plenty to work with.
Start with the diet. And of course, I want to get this in also. This is really an important point. GI function. Your GI system, 75% of your immune system lies in your GI tract. If you have any kind of GI distress, whether it's IBS, constipation, acid reflux, anything at all that's not right in your GI system, I urge you to do a cleanse, do a detox, get that GI system working the way it is intended to work, because there is a saying that all disease begins in the gut, and that is absolutely true. And very often I've had clients come to me with a health issue, whether it's hormonal or anything else really. And we do this digestive cleanse, this digestive reset, and very often once they've gone through that reset, their health issue resolves. I cannot tell you how often I've seen that happen. So choose the right foods, make smart decisions, organic, grass-fed, pastured foods, and fix the gut. Then we go from there. And very often, if you do those initial things, your health issue resolves, and there's no need for further intervention.
That's right. And always start with the path of least resistance, the least invasive, the simple fixes. And if they don't work, then move on. But certainly we don't want to take the most drastic course in any respect. But changing your diet, and all of these dietary recommendations are good for other things. None of them have side effects necessarily. They have side benefits. So eating more broccoli, if it didn't work for one thing, it'll work for something else. Drinking, dandelion root tea, is a detoxifier. It supports the liver. Everything that you can do has another benefit. And that's the key, to look for resolutions that have benefits, not negatives.
Absolutely. And the other thing I tell people is, I've done supermarket tours in the past, which means I'll meet a potential client at a supermarket, and we walk the supermarket, and you teach them how to shop. And the general rule of thumb is shopping the perimeter of the store, buying only that which was provided to us by nature. Anything in the center aisles in a box or a bag, don't even bother, because it's not going to help you. It's going to hurt you in the long run.
Right. If it grew on a plant, take it home. If it was produced in a plant, leave it there.
Exactly.
Okay. All right.
That's exactly true.
Okay. So, Karen, what about thyroid dysfunction? We talked about it only briefly. So will this magnify our symptoms of perimenopause?
Ellen, this is possibly the most important takeaway from the conversation today, and one that resonates deeply for me, because it is exactly why my perimenopause journey was the horrendous journey that it was. I can't stress that enough. If you think you have symptoms of thyroid dysfunction, see a doctor. Get proper testing. It's a very important point that I want to drive home today. Undiagnosed and untreated thyroid dysfunction will exacerbate symptoms of perimenopause. I need to say that again, because it's such a critically important point. Undiagnosed and untreated thyroid dysfunction will exacerbate symptoms of perimenopause, because the deficiency in thyroid hormone can affect female hormones. It does. The thyroid is so intimately connected to metabolic rate. It's connected to cardiovascular system. It's connected to hormone production, GI function, and also brain function. Thyroid dysfunction can cause so many problems in the body. It causes menstrual abnormalities, loss of libido. It causes impaired fertility, miscarriages, congenital abnormalities, premature delivery, and even stillbirth. I'm sure many people don't know that. So it's critically important to get proper testing. Don't settle for just a TSH. Thyroid stimulating hormone is generally known to be the gold standard test for thyroid. It's not. It's not. You cannot rely on TSH for thyroid dysfunction diagnosis. You need to ask for free T3, free T4, reverse T3, and all antibodies. You can download and print a list of tests from my website, and I urge you to do so. Print it, take it with you to your doctor, and tell them, these are the tests I want run. Do not rely solely on TSH. Too many individuals are walking around with symptoms of thyroid dysfunction without getting treatment because their TSH is in normal range. You can absolutely have thyroid dysfunction and also have a normal TSH. I know that's surprising to many people.
It's
but
not
it's
though,
true.
because it's just like if you go in for a C-reactive protein test and you tell them you want this, and they come back and say, "Oh yeah, don't worry, it's less than 5." Less than 5 tells you absolutely nothing. You need
Yes.
the high sensitivity test that's going to tell you whether you're less than 0.1. That's a big
Absolutely.
difference between 0.1 and less than 5.
It's a huge difference.
Right.
It is. And so, you
It's
can
not ignorance
have,
right.
no,
You have to know the test to ask because your doctors don't always know the test to order.
exactly. And you can have thyroid dysfunction with a normal TSH. Find a doctor who will also treat you based on symptoms. And that is a question you can ask, when you make your phone calls to try to find a doctor. If your TSH comes back in normal range, you have to find somebody who will treat you based on symptoms. When thyroid dysfunction is not properly diagnosed, perimenopause symptoms will be much worse. Symptoms are magnified in the presence of undiagnosed thyroid disorder, and the thyroid should be addressed before bioidentical hormones are used, or it could create a worsening of symptoms. When thyroid disorder is diagnosed, I urge you to have your iodine levels checked, and you can do so through a simple at-home test. It's a 24-hour iodine loading test. Supplement with iodine and the companion nutrients, and get on NDT, which is natural desiccated thyroid, if necessary. Always with thyroid dysfunction, eliminate all grains, eliminate sugar, eliminate dairy, and packaged and processed foods. Goitrogenic foods, which we talked about earlier, are great, but they need to be steamed or lightly cooked, never eaten raw. And find an iodine literate doctor. They're out there. They are out there. It's just going to take time and patience to find someone who understands the need and the importance of iodine, and will be on the same page with you if you decide that that iodine is something you want to include in your supplements.
Right. That's a very good point, because iodine literate doctor is very hard to find. The majority of them say, no, you don't need iodine. That's why we took it out of the bread. We put bromide in there. Ha ha ha. That's a side joke.
Exactly.
Right. They don't get it. And so it's very hard. You have to find somebody, and that's not going to be an easy task for most people. We're in these HMOs. We've got all these limitations these days. It is very difficult to find somebody who is educated on iodine. There's many websites that you can go to for help on that. I'm sure that Karen's website is very, very, in fact, I know it's very helpful on that, but there's so many resources out there that if you can't find an iodine literate doctor, you can visit Karen's site. There's tests on there that you can kind of do it at home tests, and then you can get support on some of these other websites, which are also on my website, listing where you can go for help. Because if you cannot find that iodine literate doctor, you may have to take things into your own hands and do these urine iodine loading tests. And actually, Karen, when I'm done with my rampage, maybe you can explain that test so people know how to do it. But sometimes it is very hard, and we do have to do some of these testing things on our own.
Absolutely. And I actually have on my website a list of recommended physicians that we continue to add to, and they are physicians and practitioners all over the country who members of my Facebook pages come to me and say, this was a great experience. This is a terrific doctor, and we add them to the list. So you can go to my website and click on the tab for physician recommendations, and these are physicians who are tried and true, that women with thyroid dysfunction and or perimenopausal symptoms are familiar with and who have helped them tremendously.
Which is a big help because, again, finding that Dr. Right is always very difficult. And, again, given our limitations these days, it's even harder because you get pushed through the mill of doctor after doctor who really has no idea, and they get frustrated with you and you get frustrated with them. So sometimes if one of these doctors is available, that is fantastic. And if not, there are, I know Karen has testing resources on her website. So
absolutely. And one other thing I want to add about finding a physician, if you are unsuccessful in finding someone who is iodine literate, for instance, at least look for someone who is open-minded and interested in learning from you as the patient. There are many women who I've spoken to who have found doctors who are just open-minded. They don't know anything about iodine, and they want to sincerely learn about it, and they learn about it through their patient, and they're on the same page. And they follow the progress, and women take the test results into the doctor of the 24-hour iodine loading, and they work together. So it's not the end of the world. You can find someone who is literate, and if not, just find someone who's open-minded and interested in learning from you.
Right. And actually, many doctors appreciate the fact that they learn from their patients. That's my favorite conversations with doctors is when I can feel that they actually have an interest in what I have to say. And they look at you like, wow, where'd you learn that? And it's very rewarding to have that kind of a conversation.
It is. And like you, I've been in that instance many, many times where I've sat across the desk from a physician and provided them with information and education that they were, completely unaware of. And those doctors who receive that information from you as a patient openly and interested in learning from you, that's a tremendous opportunity for both of you.
Right.
To work
and that's
together.
The doctor I respect the most because
Absolutely.
They are not like I know everything, and they are always open to what I'm doing might be good, but maybe that's better. And they go to conferences and they learn more and more all the time. I even like to observe it from the outside. I was at a conference and I was listening to a doctor. I was watching him interact with this woman who was really, I thought, driving him nuts. She was trying to get her whole life managed right here from this doctor at a conference as he's leaving for the airport and he has to catch a flight and she's going on and on and on and on and he's about to say, oh God, somebody please just get me out of here. And then she said something really important and he stopped and he looked at her and he goes, you know what? You can call me when I get home. I do have to catch this plane, but what you just said means you've really done your research and and I'm going to help you.
What a great story.
It was just remarkable because I could tell he was like, oh my God, is this woman ever going to be quiet? I've got 2 seconds and I'm going to miss this. I've got to go, and she just said the right thing that said, you know what? She really did do her research. She's not ignorant. She's very smart and she's done her homework and I'm going to help this woman no matter what, So
and that's an important point, Ellen. I think it's really important to be an informed patient. It really is. Go in with the knowledge. You can't just go in and say, I want this test done, or I think I have that. Provide the information to the doctor that backs up your claims.
That's right.
Why I want this test, or why I think I have this perhaps disorder or syndrome, whatever the case may be. I think that doctors and practitioners do respect a patient who has, as you said, done their homework and done their research and does appear to be knowledgeable on the subject.
Right. But one thing I will caution you is do not bombard your newly found, highly respected doctor with endless emails that are going to require him to answer a long thing. You will no longer be a patient and no longer get responses. I mean, it's just not polite. So
I agree.
I
agree.
Definitely. When you need them, you want them to be there, but please don't expect them. I mean, everyone thinks doctors make a fortune. The majority of them don't. And they're spending their hard, time and effort and away from their families on a Saturday night if they're answering this, or after hours, or in between patients when they might actually get to step out and get the cup of green tea. They're answering your questions. So have some patience. Right.
Have some patience and know the limits. Exactly. Know that this doctor was so willing to give you his contact information for you to contact him on his off hours, and just know that, respect that. Respect that. A word about green tea. You just mentioned green tea. That's another one. That's a no-no for thyroid. You want to go with white tea. Thought I'd just throw that in there.
White tea is green tea.
Green tea is not thyroid friendly, unfortunately, because it is loaded with fluoride, which is a halogen that damages the thyroid. So, having said that, white tea is a better solution for individuals with thyroid challenges. And as a side note, when I discovered that and I made the switch because I was a huge fan of green tea and drank it almost every day, I switched to white tea. It is absolutely delightful. It is actually in my opinion, it has a better taste than green tea, and I absolutely adore it.
I used to love it, but if I can't drink very much of it, it gets me jittery, and I don't like to feel jittery, so I gave that up. But I understood that the green tea leaf and the white tea are the same. It's just a matter of the processing and how long that they are processed.
And it has to do with the maturity of the leaf. And
Right.
The white tea actually has far less caffeine than green tea.
Which is interesting how it affected me, but it was so obvious that I said, okay, that's the end of the white tea for me because I like to have my 3 or 4 cups a day and I can't be walking around shaking.
Yes, no, that would be of concern as well. It's not for everybody, and people react to things differently, certainly. But
Certainly.
I always found it to be very soothing. I do adore it. So for me, it works very, very well. Perhaps not for you, but we'll find you another tea, Ellen.
I like the white. I do love the white. I had a vanilla white that was, off the charts. I can have some. I just can't have 4 cups of it like I like to have in a row.
Well, fortunately, in the summer months, you really have little need for hot tea, I'm sure.
I still drink it.
Do you?
I drink my hot tea every single day. I
do. You.
I
That's
do.
wonderful.
Yeah.
Right.
But, like I said, that is a good point to say that not everything works for everyone. Some people, no matter, even if they like broccoli, maybe it doesn't like them. So the point is always to work with your diet and work with somebody who can help guide you and say, okay, so if that didn't work, that's okay. We can work around that. There's always another option. Options are my motto. If you don't know your options, you don't have any. And Karen has just presented a number of options for perimenopausal symptoms and other health-wise. So there's always options. You just have to work with what works for you and your body.
Exactly. And do what feels right for you. And I'd just like to add that, my journey through perimenopause could have been so much smoother had I been able to find a doctor who understood that TSH was really not the gold standard for thyroid testing and that symptoms are a much better indicator. So through my journey and my learning experience, I am in a position where I can help women to navigate through this very, 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 or could be very difficult part of life through my own experience.
Right. So, Karen, we're just about out of time, and I want to give you a minute or two to talk about your website. Give that web address, please, and just a small generalization of what they're going to find on that site.
My website is KarenDameHealingSolutions.com, and on that website you will find blogs of supplements and protocols. You will find actually the iodine protocol. You'll find supplements all categorized. There's actually a category for perimenopause and menopause, which include many of the supplements that we talked about today. There is a page for test kits that you can look at and evaluate. There's the 24-hour iodine loading test if you are interested in checking your iodine levels to see, what your thyroid function is. There are ways to get in touch with me. I do have an email address, Karen@KarenDame.com. Lots of information. On the top of the homepage, there are links to all of my Facebook groups. We have a Healing Solutions group, which is for general questions on different, areas of healing. We have a Healing Solutions for thyroid, a Healing Solutions for perimenopause and menopause, and we also have a Healing Solutions for pets, for those of you who have pets. Mm-hmm.
Great. Well, and I have to say a little bit about Karen's Facebook pages. The groups are fantastic. You will learn a lot on those groups. So please, if you are a Facebooker, although they're having some odd problems today, technical difficulties, but most of the time it's pretty easy to wander around Facebook and get some fantastic information, and certainly in Karen's groups.
Thank you.
Karen, thank you very, very much. It's been my extreme pleasure to chat with you today. I
Well,
look
the
forward
pleasure
to.
has been mine. Thank you very much, Ellen.
Well, you are very welcome. I always enjoy learning from you. And this has been Survive and Live Well, Tips to Treat and Beat Cancer on Cancer Support Network, W4CS.com, where you can listen live Tuesdays at 1 p.m. If you missed any part of this show, you can catch it on my website, www.ellenjacobs.wordpress.com, or on iHeartRadio Talk. Join us next week when I chat with Lisa Lynn, and we will talk about how losing weight could save your life. This is your host, Ellen Jacobs, one-on-one cancer coaching, empowering you to treat and beat cancer. See you next week.